So Jinlong, have you come across PSH? Sympathetic hyperactivity case. This happened from post-surgery. It will have sudden episode of rapid heartbeat, high blood pressure, increased respiratory symptom, sweating, muscle rigidity. When above happen, it can be life-threatening and doctor will need to give a lot of medication to calm him down. Can patches help? My friend understand patches may have reaction to his body. He's only afraid the reaction from patches will cause him to have above mentioned episode. Okay, I don't think so. It will create this episode. Is because if you have a sympathetic hyperactivity, what life is trying to do, it will rebalance it to be parasympathetic. Okay, so this is why I think it's very safe to use the product. Okay, if you're really concerned, you can put the patch still X39 and Eon. Okay, but you can start with Eon first at night and then you see how it goes and slowly add 3 hours X39, 3 hours, 3 hours, 3 hours, and then add to 6 hours a day, then add to 12 hours a day. Okay, you can always do it this way. LifeWave confirm work. But you see, guys, this is what I'm saying. You go for surgery, it's also not getting better, right? And the worst thing is, I don't know what kind of surgery, but maybe the surgery is for, okay, maybe I ask Priscilla to share. Priscilla, can you unmute yourself, Priscilla?
Hi,
Hi,
can you hear
Priscilla.
me?
I
Hey,
can hear
hi.
you.
You
Hi.
can, huh?
Yeah. Oh,
It's me.
yeah, I know. When you say
I
nah, then
can't,
I know you are same wife already.
yeah, I can't open the video.
It's okay. So may I know
Okay,
what surgery your friend has done?
okay, what happened was, he had a stroke.
Yeah.
So they went to do a surgery on his brain. Then, because I visited her husband recently on
Yeah.
Wednesday, and then she told me, they did a brain surgery. And
Yeah.
when he came out from the operating theater, he actually have a tube in the head to drain out the water. So the tube, according to her description, there is actually three pillar to support the tube.
Yeah.
So what happened was the tube came out of the head.
Yeah.
And the worst part was they didn't realize it until very late at night. So
Yeah.
that's why she said it causes this they call the PSH.
Yeah.
So she actually also got asked the doctor, the surgery, why should this happen? You know, it
Yeah.
should be very secure.
Yeah.
But the doctor said, I don't know.
Oh
So
my
it kind
goodness.
of a bit of like the Jana when they wheel him out from the ICU. Because nobody realized it. She told me until very late at night. So and then this whole thing happened. So yeah, that was the time that I asked you what to use. And she told me her reason why she dare not to. Actually, the husband did use LifeWay before last year.
Yeah.
Also, he had some strokes happening. So I kind of spoke to him.
Yeah.
And I think because he was a bit impatient with results,
I see.
when we went to explain to him about it, we did tell him that don't be surprised if you have some reaction, like,
Right.
more pain, because he told me his left hand cannot leave out and it's painful. So
Yeah.
that's where he thought, okay, give it a try. And when we explained to him, that time we did tell him. And then along the way, I heard from the wife that, oh, he had this issue, pain. And then I kind of asked you, and you say, oh, it's very good when people just started using, they have, such reaction,
Yeah.
means something is healing, which I
Yeah.
explained to him. I sent the video to him. I even show until where he should start listening.
Yeah.
But it always like a one-way conversation with him.
Yeah.
So subsequently, I don't know why he stopped using. And then actually, I heard last year, October, he actually had stroke again. And then she was telling me, oh, doctor says, he's very lucky, very strong, he survived. But I told myself, if he's not going to take care of himself, he's going to get it. So I
Yeah.
didn't really contact her for quite a while until recently something just tell me, hey, just send her a message. And that's where she told me he just got a stroke 2 months ago and still in hospital. So
Amazing.
yeah, so I was thinking, and she was quite afraid because what happened was this episode when his heartbeat all came out is very bad. That day when I went, she told me what you saw is very mild only. So when she described to me, when she saw it, she cried and she couldn't erase the image away from her mind, the very bad. And today, actually, she told me it happens again. But today one
Okay.
was quite mild, the episode.
I see. Okay.
So yeah,
So I'm going to give you this advice. So X38 is always a way to go. But if you're really so afraid, right, you can start with Egon first. If you still so afraid, right, don't worry. You can say, don't worry. Let's say the main is Amy. Amy, it's going to take some time for you to accept the patches because you are really in those kind of traumatic experience already. But I heard from my senior, all these symptoms of the rapid heart rate, sweating, muscle rigidity, we don't think about the medical term first. All these things is a sign that your body is in need for more energy, more calorie. You ask about her diet, make sure she eat enough white rice.
I mean, he cannot eat. He's in tube feeding
Okay. If he
with
cannot,
the tube.
right. If he cannot do any solid food feeding, can only take the milk, right? Then you ask them to the doctors, is the person eating enough or not? Because they always have a volume to gauge, say that how much of milk powder, how much of milk they're drinking a day. If you say, oh yeah, he actually not drinking enough, then you can tell her that if you don't patch, this is going to get more and more worse because now he is not even absorbing and taking the nutrient already. Then you
And
can start with Eon.
he's actually not in coma,
Yeah.
neither is he conscious.
Yeah.
So the term they put him is his semi-unconscious stage.
Right. Can.
Yes.
Can. No problem.
So start with Eon at the belly button,
Yeah, you can start with if it's very difficult to lift him up, right? Then you can start with belly button, it's fine.
and then next day S39 also at the belly button.
Yeah.
So start with 3 hours lah.
Yeah.
I'm not sure whether she dared to try because she saw him, that symptom came up, she very scared. She understand the patches will have reaction. So she actually told me lah that she's scared it will trigger and then, the blood pressure high, those things. Yeah.
Yeah. So then the answer is on her. Do you think that his husband is going her husband is going to get better and better with the assisting treatment? Or at least he
Mm,
want to try a sticker for 3 hours? I think is really a call. And I don't think that if the doctors after doing all the negligence things and make him like this, and yet he still want to just listen to the doctors without open exploring other alternative, right?
mm. And one very strange thing is that day when I was there was a nurse inside there. His toe started to have red patches. It's neither blood nor things. Even the nurse who is doing the, cutting and clearing, she also don't understand why there are red dots starting to appear. And apparently, I think I remember she told me she's a little bit of diabetic, if I
I
remember
see. Okay,
clearly.
if got red dots, right, it means that the platelets is going down already. They mean the healing factor is going down already.
Mm,
Yeah. So this is why don't worry, we just take a photo of the red dots. Okay, and this can be a sign when you put the pad, the red dots start to disappear or the recurrence getting less. Then it's a good thing.
mm. Okay, okay.
Okay.
Yeah. In fact, she was the one yesterday when I asked, she fell down. The same lady.
She fell down.
Yeah, I asked 3 questions yesterday.
I forgot already.
Yeah. One is a blue bag one, which is Sam lah. He fell
Yeah.
very badly. And then
Ayo.
the other one was I was asking whether, how to help with the broken ribs.
Right.
Yeah.
Understand. Okay. Okay. Can. So thanks, Priscilla. I will go to the next questions.
Okay.
Thank you.
Okay.
Thank you.
Thank you. Thank you. Mm.
You see, this is why I say very different, right? Just now, let's say who is the first gentleman, Simpson. Simpson, when he feel the reaction, he said, I want to know the root cause. And then he find out, oh, it's because my old injury last time when I played ping pong. So now I'm healing the area. I wake up at 3 a.m. I got no lung problem. Oh, but the lung cousin is intestine. So now, the past 1 week, he got no constipation anymore. And just now we have a gentleman wake up at 2 a.m., stroke patients, have faith. This is healing crisis. I want it to happen. I know I will continue. And 2 a.m. wake up, liver problem. And then he said, yeah, now my nail is growing faster. You see, this is the perspective difference. Some people are so fearful of exploring new possibility. The thing is, do you believe you can get better or not? If you don't believe you can get better, a doctors from a stroke do a surgery and then got a side effect, tingling there, never pay attention, is a medical negligence. And you still want to follow doctors, what the doctors say, and not exploring other alternative. So if something bad really happened, whose fault? Is it your fault of not exploring? or you still want to continue to blame the doctors, right?